Caitlin McDonald with Swiftshirt Equine Veterinary Services. And this is a little tutorial video to show you guys how to give an intramuscular injection in your own horses. So sometimes we ask clients to medicate their own horses intramuscularly. The cases where you would maybe be doing that would be with antibiotics, or if you needed to sedate your horse, some sedation can go intramuscular. So Belle is our very willing participant for this demo today. So it's important when you're giving an intramuscular injection that you pay attention to the anatomy of the horse's neck to select the right spot to give the injection. So their spinal column runs along the bottom of their neck, so kind of the widest part right above this groove for their jugular. So that's their spine in there. And then along the top of their neck, this thick band here, their nuchal ligament is there. And so you make a triangle between the nuchal ligament, the top of the spinal column, and the front of the shoulder. And so it makes this triangle right in this space. And so anywhere in there is safe to give the injection. So I always like to do it a little bit further back, but you can also give them further up here. And so what you're going to do first, make sure Belle's nice and clean today, but if your horse just came in out of a muddy pasture, make sure the area is clean, that you're not going to be dragging any dirt in with your injection. And so then pick your area, find your triangle, get a sticker right there, Belle, and pinch a little bit of skin so that you're not surprising them. And then you're going to take the needle right behind where you pinched and go in perpendicular to the surface of the skin. And you need to commit a little bit while you're doing this to break through the skin. Push all the way so that the needle is buried to the hub. And then we're going to pull back on the syringe and make sure we get an air bubble at the front instead of blood. If you get blood, you need to pull out and reposition. Once you've got your air bubble, then you know you're good. And you're going to push the medication in at a reasonable pace. You don't want to go in too fast, but you also don't want to stay too long. And then hold the skin, pull it back out, give them a little pat, and then they get a cookie.